Imagine someone being able to look inside your body without a scalpel, without radiation, and without pain. You simply lie down on a special table that slides into a large tube, and after several minutes, an incredibly detailed image of your brain, heart, or knee appears on a computer screen. How is this possible? How does magnetic resonance imaging, MRI, work? And what does it have to do with nuclear physics? Stay with me, because today we're going behind the scenes of one of the most powerful technologies in modern medicine. Let's start with the basics. Our bodies are made mostly of water. Each molecule of water consists of 2 hydrogen atoms and 1 oxygen atom, and every hydrogen atom has a single proton in its nucleus. These protons are the key to how MRI works. While this may sound like high school chemistry, don't worry, it will all make sense in a moment. Protons act like tiny magnets. Under normal conditions, these mini-magnets are arranged randomly. But when a person enters a strong magnetic field, like in an MRI machine, the protons begin to align in one direction, along the lines of the magnetic field. It's as if thousands of compass needles suddenly started pointing north. This alignment alone doesn't create an image. Here's where the second crucial element comes in: radio waves. The MRI machine sends short pulses of radio waves that knock the protons out of their positions. It's a bit like flicking a compass needle. It stops pointing north for a moment, starts vibrating and spinning. When the radio wave stops, the protons return to their original alignment, emitting very faint radio signals as they do. These signals are picked up by sensitive detectors. Each part of the body emits a slightly different signal, depending on the amount of water, the type of tissue, and how quickly the protons return to their place. These tiny differences allow a computer to assemble a detailed image of the inside of our body, layer by layer. It's like taking cross-sectional photos, without any cutting. So what actually makes MRI so precise, even for soft tissues that can't be seen on a standard X-ray? The answer is water, or rather, the differences in water content among various tissues. The brain, muscles, fat, and bodily fluids all have different densities of water molecules, which is why they appear differently in MRI images. Additionally, the operator can adjust the scan's parameters, like the length of the pulses, the intervals between them, or the angle at which they're applied. This lets them tune the contrast between different tissue types and tailor the scan for specific purposes, such as detecting tumors, inflammation, or nerve damage. MRI is also exceptionally safe because it doesn't use ionizing radiation, unlike X-rays or CT scans. That means it can be used even in children, pregnant women in special cases, and people who need frequent checkups. Of course, MRI isn't perfect. It's quite loud. The patient hears characteristic knocking and humming because there are powerful electromagnets inside the machine that switch rapidly. For some people, being in the narrow tube can be uncomfortable, especially if they're claustrophobic. There are also contraindications. MRI isn't performed on people with pacemakers or metal implants, as the strong magnetic field could interfere with them. Despite these limitations, MRI is now one of the most important diagnostic tools in the world. It helps detect cancers at early stages, analyze brain damage after a stroke, monitor the progression of neurological diseases, or assess the condition of internal organs without surgery. It's like having super precise vision that can see through skin and bone. Interestingly, MRI is a perfect example of the fusion of physics and medicine. Although it's based on discoveries by scientists studying atomic nuclei, today it saves health and lives around the world. And it all starts with a single proton that simply likes to align with a magnetic field. If you found this topic interesting and want to learn more about how physics works in everyday life, including in medicine, subscribe to our channel, give a thumbs up, and share this video with someone who also loves discovering how the world works. Thank you, and see you next time.